Hi, thank you for joining us today. I'm Melissa Banton. I'm the Director of Breast Cancer Survivorship at Johns Hopkins. Today we're joined by Don Dizon. He's an oncologist specializing in women's cancer at Lifespan Cancer Institute. He's the Director of Medical Oncology at Rhode Island Hospital. He has an interest in survivorship with a specific interest in sexual health. Dr. Dizon, thank you for joining us today.
Thank you so much for having me.
So I'd like to start off talking a little bit about the role of social media and how patients, why they want to get involved.
Well, it's an interesting evolutionary process, but we're in an era where the catchphrase is patient engagement. And a lot of that, I think, has occurred through the availability of the internet. And as a result of that, through social media, we do know that patients are more and more turning to the internet as a first source of information. And sometimes before they come to us at our institutions or their doctors, they're now finding these communities where they can vet the information, get other people's perspective on it, and really feel less alone. So I think that's where social media has come in. And it's just as breast cancer is not just one disease anymore, what we're finding in social media is the ability for patients to find each other. So you have a community for women with inflammatory breast cancer. You have a community for women with HER2 positive breast cancers, and you have a very vocal community of women with metastatic disease. And I think social media has just allowed for the formation of those communities regardless of borders, really important, regardless of socioeconomic class, and regardless of any other factor that we are concerned about with health equity. The only thing that's seems to be the issue is access. So you have to have an internet, and more often you have to be in a community where you don't necessarily have to pay for the internet. So as a result, we're seeing a lot of folks on social media who may be more educated, more literate, because we do see that a lot of these communities are based on English settings rather than, say, Asian, Chinese, Japanese communities. But in the end, it just allows for deeper connections, deeper engagement, and then real ways to become an advocate.
Are there sites that you would recommend for patients if they were interested in getting involved but didn't know how to get started that you like?
You know, I think one of the easiest ways to get involved is through Twitter, quite frankly. Twitter just requires you to create a username and a password, but then if you want to follow conversations in our space, you can do so quite easily through the use of a hashtag. And the one for breast cancer is hashtag BCSM, hashtag breast cancer social media. And that's a nice place to start because you do not have to participate on Twitter. You don't have to participate in any conversations, but you can follow a feed. And those feeds go back in time, and you can see what kind of conversations have been discussed. And then you can find people whose voices you actually seem to agree with, and you can actually develop a list of folks where you can follow. Beyond that, I think going with your hospital, your institution, and the survivorship community that you have locally is also a great way to connect on Facebook. So there's some real nice ways to get involved. Those are two of the ones that I find most useful, at least to start.
So when you're using a platform like Facebook or Twitter, how do you decide what information you should share and what's too much information?
That's a very difficult question just to have a broad answer to. What I will say is it's a very individual decision. And I think part of it is based on what kind of information are you looking for? And then, or the other side of the coin is, what message are you trying to convey? And I think if you looked at it with that lens, the answers would be fairly simple for the individual. What's too much information to share? That depends also, it depends on whether or not you're the clinician or the patient. For clinicians, I think the lines are very clear. You can share whatever you want as long as you're not divulging anything confidential about a patient.
Sure.
That's the line in the sand. We don't want to break HIPAA. For patients, though, I think there's no clear answer there. I've had patients share their entire history of metastatic disease in a series of tweets. And I've had other patients share very minimal information. Yeah, I had breast cancer at some time in the past. The important thing to know is that, when you share something on social media, as much as you want to make it a private thing, in the end, anything that's out there is discoverable. At the worst case scenario, we know, what happened with Facebook in the election, that all of our private information was probably accessed by a third party, and they got a lot of stuff on us, even though Facebook is a private account system. On Twitter, everything is out there. You can't really take it back, and it can be mined. Although for everyone out there, I think institutions are looking at even studies using Twitter with a very close look, because we still want to make sure, even if it's public, that we're not hurting anybody.
So it sounds like the same advice I give my children. Once it goes out to the world, you can never put it back in.
And I think that is incredibly good advice that everyone should understand.
You mentioned the difference between patients and providers. One of the things that we sort of struggle with is, how do you draw the boundaries between your clinical world and your patients? And is it appropriate for your patients to friend you or follow you?
Yeah. Well, that is, I think to answer that question, I'll give you my approach. I use certain forums for my clinical world and my professional space, and I use other forums privately. In my professional space, patients can follow me, patients might friend me on Facebook, and that's fine because it's there for the world to see who I am as a physician. My private space is me, for my family and my friends only. And I make it a habit not to friend colleagues who are also friends in that space. And I've made it so that if patients look for me on Facebook or Twitter, on Instagram, they will find my professional profiles first. So I think that's very important. In terms of friending and following, what I would say the caveat there is for providers to think thoughtfully about what they're seeking to use that media for. If patients are following you so that you can utilize your platform to promote really interesting developments in our field, current events that are relevant to your oncology practice, and you want a forum so that people who know you know what you're thinking about, then I think there's no harm in having people friend you, no matter what the thing is. But if you're using your persona to develop a reputation as a public figure, okay, and you're sharing both private and professional stuff on that page, and you're having patients join that so they can see who you are as a person, I think the danger there is that they might discover much more than you thought that they had reason to want. And I do think even for us as clinicians, we deserve a private space.
Sure.
And so I'm clinging to that for as much as
Sounds like a good way to dichotomize it, though. I like that.
Yeah, I think so. And I think it works. You don't have to be a doctor for this. I mean, you can be a patient advocate and do all this work on behalf of the breast cancer community. It doesn't mean the community has access to your private life. Yeah.
I like that, the idea of keeping some things public in the public
Yeah.
sphere and then keeping the pictures of the grandkids and other
Right.
things private.
That's
Yeah.
exactly it.
Yeah.
Yep.
Yeah.
They don't need, well, not that they need. The fact that my mom celebrated her birthday
Right.
X, Y, and Z is something that I want to share with my sisters.
Right, right.
I don't think this helps you understand who I am as a doctor by sharing that kind of information.
And probably doesn't improve your care.
You're right. Exactly.
Makes a lot of sense. For people that are involved in social media and things go wrong, are there sort of parameters or places to go if you find yourself in trouble?
Well, I think the first thing, the best advice I could probably give is to seek out help within the sphere you find yourself in. For example, if I tweeted something that I later very much regretted tweeting, I would be the one to come to my compliance group and bring it and say, I don't, whatever my concern is, just you should be the one to bring it forward. So that's, ownership of everything you've done is part of what being in social media has taught me. It's very hard to pass the buck about that. But you know what? Just like we learned in grade school, because you mentioned your kids, there is very much significant power in admitting something was a mistake and saying, I'm sorry. That's
Good life lesson.
And it can really cut down on a lot of barriers. I think the hardest part from the provider side is when that error or that mistake was a breach of confidentiality. Unfortunately, people, physicians, clinicians on social media have been actively sanctioned for those kinds of mistakes. And it's very hard to backtrack on that.
Sure.
Yeah.
Do you ever find that there's a slippery slope with regards to being too plugged in and sort of this sort of world that we live in where we're all walking around with our phones and you don't have a minute of sort of being able to go to the bathroom without checking your phone?
Yeah.
Does that happen? And how are there sort of ways you can police yourself to prevent yourself from being too connected?
Well, I think not only does it happen, but it's the biggest fear of my colleagues in oncology, which is they're checking their email all the time. They can't imagine that they're also going to be on Twitter and checking their Twitter feeds all the time. And so there's this very big concern of being over-connected. I like that term a lot. I'm going to start using it. So I think part of what we need to do is we who are on social media really need to ask, what's the value of this? And so I'm actually trying to, a group of us has banded together to try to bring an evidence basis to social media. And we're calling ourselves a collaboration for outcomes using social media in oncology, COSMO, right? So we're looking to actually, find out what are the key questions and how can we go about answering these key questions so that we can make a value argument to our peers in medicine about why you should take the time to be on social media. For me, it's obvious. It's about engagement in a very high level, and it's about learning perspectives that I may not ever have any way of understanding before social media. By listening to the conversations that patients and patient advocates are having about the same data set, you get a very different perspective from that point of view, and I've learned a lot from it. In terms of being too connected, it happens. It happens all the time. Some of the roles that I've adopted have come from my kids and my family who've demanded of me. And some of it is really realizing that if I'm always on the phone, I'm missing out on my life.
Right.
So usually when I go on family vacations, I don't connect on social media. I put it all away. I put email away. I actually do an out of office.
Wow.
Out
of office.
I actually stay out of office. I actually don't answer my emails when I'm away. There's a certain point at night when the kids turn off the TV, I turn off my phone. So there are things that you have to actively do to stay grounded, I think.
But it sounds like if you can police yourself, there are a lot of benefits.
Absolutely. I think there's more benefits than risks on social media if you just treat it with the respect that it requires. And and you decide which realm you're going to operate in. So when I first started on Twitter, for example, I had a personal Twitter account and a professional Twitter account, and I found myself tweeting my personal stuff on my professional account, and I quickly would delete these tweets, but I knew that someone might have seen them.
Sure,
Yeah.
sure. Well, this has been really helpful. Thank you so much. Thank you for joining us today.